Welcome to Week 4 presentation, Diseases of the Blood and Blood-Forming Organs. This is Dr. Regina Glenn, and I will be hosting this presentation. Anemia is the most common disease of the blood. In order to properly code anemia, the physician must state the type of anemia. A coder cannot assume a type of anemia without supporting physician documentation. A couple different types of anemia are iron deficiency anemia and blood loss anemia. Blood loss anemia can be either acute blood loss anemia or chronic blood loss anemia. Again, in order to be able to code these specific types of anemia, it must be documented by the physician. Just because a patient presents with a massive GI bleed and receives several blood transfusions, a coder cannot assume acute blood loss anemia. It must be documented. Other types of anemia include chronic anemia from a disease, aplastic anemia, and sickle cell anemia. There are several diseases that can cause a chronic anemia. These include neoplasms and chronic kidney disease. Anemia due to a chronic disease has a combination code. For example, anemia in neoplastic disease codes to D63.0, and anemia in chronic kidney disease codes to D63.1. One type of aplastic anemia is pancytopenia. Pancytopenia includes anemia, neutropenia, and thrombocytopenia. A separate code for these conditions would not be assigned when assigning the code for pancytopenia. Sickle cell anemia is a hereditary blood disorder. A patient may carry the sickle cell trait without having sickle cell anemia. When a patient does have sickle cell anemia, it can be with or without crises. The physician does have to document the crises. Watch for combination codes for sickle cell anemia and specific types of crises. For example, sickle cell anemia with acute chest syndrome is coded to D57.10. Another common disease of the blood is coagulation defects. This includes prolonged clotting times. Prolonged clotting times may be caused by medications such as Coumadin or Lovanix. This is the desired effect of the medication and should not be coded as an adverse effect of medication. It should also not be coded as a disorder of the blood. Prolonged clotting time or coagulation defects should be coded to abnormal clotting time R79.1 when caused by a medication. This is the end of the presentation on diseases of the blood and blood-forming organs. If you have any questions, please contact your instructor.